men and women can get, especially from bike riding, because it's the way the seat is shaped, that it rides on that inner part of your groin. And there's not a lot of nerves there, but there's this one nerve called the pudendal nerve, and it's on the inside of your bone, and it just gets grinded on by that bicycle seat. And people will develop this terrible pain with sitting down.
Welcome back to Unfilter It
with Lindsey and China. Here we are.
Today we have a very special guest, one of the amazing surgeons in our practice, Dr. Lakhiani. So we're going to talk to him a little bit about who he is, what he does, and how to know if you would be a good patient for him, and just what he could do to help you. He's doing so many amazing, things with peripheral nerve surgeries and literally all the things he could do, all of them. So let's talk a little about your training, your background in a little nutshell. So I don't want you to have to speak for an hour about your training and all, because it's very intense.
Yeah, it was a fun time going through, but thank you so much for having me here. It really is a pleasure to speak with you. And, being a Jersey boy, we grew up here and went down to Virginia for school, stayed down there, went to Georgetown for residency, and it was really there that we had a mentor who now does, he's the chief medical officer at one of the premier nerve companies in the country, and he got me inspired with nerve surgery. And the thing is, in the States, we don't have a lot of training that is focused on nerve surgery. So I actually went to Taiwan, where I did my fellowship training in peripheral nerve surgery there. And one of the reasons why is because in Taiwan, they have a lot of motorcycle use. So people suffer injuries all the time over there that involve their nerves, and they just have a lot of it and become masters of it. So I went there for a year to learn it, and then came back to DC for a short time, and until I decided to find my New Jersey roots again and come back here to bring this surgery that we went over the East Coast and around the world to learn back to New Jersey.
And I think that's great. And my experience with peripheral nerve surgery was with Dr. Elkwood for a decade. So for anybody listening, the Plastic Surgery Center, or it's really advanced the Institute for Advanced Reconstruction is huge on peripheral nerve surgery, limb salvage, all types of reconstruction that is not typical for all plastic surgeons. So they're highly, highly specialized and sought after. Patients are flying in from around the globe to see surgeons in our practice, and they're really making big changes for people's lives, which I love. So I always loved all the peripheral nerve surgery. We had an episode with Dr. Kaufman about phrenic nerve. So awesome. When I started with them back in 2008, they were all kind of just starting to do it for a couple years. I'm sure it was before that, but I was kind of in when they were trying to decide how to do everything and set parameters and who's good, who's a good patient for this, who's a good candidate. So just to see the progression of the whole practice from then to now is insane. And it took Dr. Elkwood a very long time to find someone that he trusted with all of his information and everything that he learned and even taught himself. And that's when Dr. Lakhiani came in. So I think that's amazing. And we have a summit every year, and when I listen to you speak about it, just what you've changed and what you've added to those surgeries with your following the pre and post-op EMGs, just like all those little parameters that you're adding into it now, it just gives everything even more robust technical ability to the surgery. So he's doing surgery and then testing the nerves to say, oh yeah, this looks like it's going to be a good outcome. This may not be, and really, catering the aftercare for that patient.
Yeah, thank you. And Dr. Elkwood was truly a pioneer, but with everything, as we come out of the Wild West, we want to start thinking about how we can make things repeatable and reproducible, and like you said, focus to the patient individually. And we look to use every available resource. That's the benefit of being at ARSA and being in a private practice, is that we have every resource available to us, including using intraoperative nerve monitoring and EMG testing, so that we can really honestly see what the status of these nerves are before we work on them and how they're doing afterwards, and really be able to tailor not just what we do, but also tell patients if we think they'll be able to improve.
Right, and just to be able to give them that hope is huge. 'Cause
Yeah.
they
This
already
is
have
like
some
a
hope.
whole other side of plastic surgery too that's new to me, 'cause I came from strictly cosmetic. So, you know, for me to come in and see all the cooler stuff that happens in plastic surgery, and I don't think, at least people that I've been exposed to really know that there's this other faceted world of reconstruction and plastic surgery, because, you know, people that like reach out to us for Botox and things like that think that you're doing surgery on like breast augmentations, tummy tucks. You know, one practice I was in, he did a lot of hand surgery too from accidents, but like there's a whole other world out there in plastics.
Yeah, well, I mean, honestly, I think you may have the cooler
I don't
part
know.
of plastic surgery, but
I mean, I used
but-
to love me a good
yeah.
tram flap. I love breast recon.
Yeah, like lots of breasts, but there's like all this other stuff
Everything
that's
else.
out
It's
there, and you
insane.
guys are so super specialized. So
Yeah.
like as when you were doing your training, like what about plastic surgery and nerves was appealing to you?
Well, with so much of plastic surgery, and you know, we really like to say we're plastic and reconstructive surgeons, and we're on the reconstructive side of that. And all of that other stuff is great, and cosmetic surgery is great, but we usually like to say that a reconstructive surgeon is always a cosmetic surgeon, because you not just have to restore their functioning, but you have to try to restore that sense of self and identity. And nerve surgery in particular is great because you don't just improve what you see, but you improve how something moves through space and time. You improve how somebody can interact with their environment. And that's a really special thing to be able to give back to someone.
100%.
That's awesome.
Some of those patients were my favorite patients of all. They were just so thankful that they could move a
Yeah.
finger again. And to think about that, and then the other side of our practice that just wants a bigger
Like, I don't
boobs or
like my
something.
finger.
You know, it's kind of like, and they're like, okay, calm down.
No
Like I have
judgment on
in
that.
one room, I have a patient that, you know, really just wants to use their hand, you know, and then the other room. So it's like the scale, it's like way
Yeah,
too
that's
extreme.
wild.
So that's kind of what's
Yeah.
fun about our practice too, where you can
Absolutely.
really see everything and gauge it all and meet so many interesting people.
It's nice that there's so many of us that we really can have someone focus on, like you said, the person who wants to move something again, and someone else really focus on, you know, the aesthetic side of things, which is important too.
So you're doing a lot of upper limb nerve reinnervation. So talk a little bit about that, right? You're doing all of it.
I do.
Tell me.
Yes. So right now, my practices focus on facial reanimation. So people that might have Bell's palsy or brain tumors where they can't move a side of their face. We also do a lot of pelvic pain. So this might be women that have prolapses or cesarean sections that now are left with chronic pain. So it's actually a lot of young men too. Believe it or not, young men who do a lot of weightlifting or bicycle riding
That's what I was gonna say.
can also develop very severe pelvic pain. So a good portion of my patients are young men that have developed it as well. And then I do a lot of lower extremity reconstruction and lower extremity reinnervation procedures to restore people's ability to walk. And then with our hand surgery colleagues, we do something called functional muscle transplantation in order to make elbows and shoulders move again too.
So wild.
Mad science, yeah.
That is so cool.
It's a lot of fun.
Yeah.
Yeah. When you're not doing all these amazing things and saving everybody's function, what are some things you like to do outside of work? Do you do anything outside of work? I feel like you're just always working.
There is a lot of work, yeah, but you know, I like to just spend time with my wife, you know, go down to the beach, go for little walks. Actually, I don't know, I'm a little embarrassed to say this on a podcast, but my main hobby is astronomy and astrophotography.
Did you see
That's
the Northern
cool.
Lights the other night? I'm a big
Yeah, it
geek
was
like
pretty-
this too.
pretty
I love it.
amazing,
I
yeah.
missed it. I didn't know it was
Yeah.
going to happen. I was like,
Oh
now
my
I'm still gonna
God.
have to go to Finland.
You're
Forget
gonna have to
it.
wait,
I'm
yeah.
gonna go. Forget
Yeah,
it.
like
You gotta
it
go.
happens
There's
once
some
every
comment the other
million
night.
years, right? It's something crazy.
It just
Yeah.
depends if it's clear and there's like all these parameters, but it was intense.
Yeah, the sun's going through like a cycle where it flares a lot now, and yeah.
All right,
it
we need
does
to be
that,
on a
yeah.
text thread together. We could do a whole podcast about that because I'm a
Yeah.
big geek like that too. It's
That's
great.
great. I love
Yeah.
that.
Yeah.
So
I originally
going-
wanted to be
Yeah.
astronaut. My mom wouldn't let me.
Going back for
Why
a
not?
second to your pelvic pain patients, because we had an episode with Dr. Emily, the pelvic floor
Yes.
therapist, that was talking a lot about chronic pain for the pelvis.
Yes, pudendal nerve injuries
Yeah,
and
she sees
things.
primarily
great.
females. So, and you mentioned something about cycling that I want you to just kind of talk a little bit about. So, like, there's this wave of men, young men, who are doing like, you know, the Ironman, the cycling, and the heavy lifting. So, what are some of the risk factors that they impose upon themselves doing those activities for? Like, what kind of pain would they expect to have afterwards? Because I think a lot of people are walking around with this and not realizing
They're
that.
like, oh, it's normal.
Probably
I'm getting
so.
old, or who knows what. That's like what I do.
Yeah, that's what a lot of us do. Yeah, until it gets severe, you know, we just deal with it. But men and women can get, especially from bike riding, because it's the way the seat is shaped, that it rides on that inner part of your groin. And there's not a lot of nerves there, but there's this one nerve called the pudendal nerve, and it's on the inside of your bone. And as it comes up towards the pelvis, it just gets grinded on by that bicycle seat. And people will develop this terrible pain with sitting down that can extend to their genitalia. They can have pain with defecation or urination. It can be really constant for them. And essentially what we're talking about is nerve irritation that's just like carpal tunnel syndrome, and that's really all this is carpal tunnel syndrome of the pelvis. And thankfully, it's something that's treatable in a lot of cases. The earlier you get to it, the better. Because what happens is when you ride a bicycle, you build up that scar tissue from friction on this nerve, and a surgical decompression is going in there to release that scar tissue, and now the nerve can breathe again. And once it gets oxygenation and blood flow, it heals itself, and the patients do much better. It's a happy nerve is a loose nerve, and that's what we do.
And that's how it is
Yeah, we
everywhere.
have a T-shirt that says that.
Happy
Right.
nerve is a loose. Oh my God, there's your billboard.
There we go.
There
Did we
it
just
is.
did we just go viral?
Did it.
Yeah.
We just did it. Oh my God.
So, what are
funny.
some tips that you might have as the surgeon that corrects this for people when they're riding their Peloton or they're cycling?
Yeah, it's funny you say the Peloton. I say that some people are Peloton pudendals.
Yeah.
Because thankfully, if you get it from bike riding, it can be a bit easier to cure. But the biggest change you can do is one, either stand up while you're pedaling sometimes. The thing is, you just don't want to be pedaling consistently several hours at a time sitting, or get a bucket seat. That's the easiest thing that you can do, is just get a different seat.
Not
And-
that little skinny one. I don't know how anyone can survive on that. Honestly, I have a Peloton. I can't survive on that.
Well,
got
I
a bigger
think
seat.
too, it's like there's like a mindset of Peloton where it's like you have, you know, they have a tracker and it's all great for cardiovascular health, I'm sure, but it's like how many streaks can you get?
Yes.
You
It
know,
gets
and you're
addictive.
working yourself up to like your endurance ride and whatnot. But yeah, I went on the Peloton right after childbirth and I had a C-section, and I was like, that's weird. I got this weird tailbone pain.
Oh.
And so I was like in pelvic floor therapy and thankfully, shout out to Dr. Emily, she helped out. But it was
Good.
likely something definitely from riding the
100%.
bike, because that's
Yeah.
all I was doing constantly.
Probably was, and you probably helped yourself by just stopping to do that and doing early therapy,
Yeah.
and you fixed it.
But common problem I bet a lot of C-section or non-C-section moms have after getting on the bike and doing stuff.
Yeah, definitely. We see that a lot. The other thing is a C-section, sometimes they cut nerves in the belly, and people get pain that way too. So I've definitely had moms come to me that, you know, have pain in their
Neuroma or
bellies.
something.
Yeah, neuromas from the cut nerves of the ilioinguinal. And, you know, usually they say, can I get a tummy tuck at the same time? Which is fine. You get a little nerve surgery, and that's the little bit of cosmetic surgery I do
There it is.
is little
That thing.
tummy
But you
tuck
have to have
thrown
nerve
in.
surgery to
Yeah.
qualify for some cosmetic
For
surgery.
my cosmetic surgery, yeah.
It's the only way you're getting in, ladies
Yeah.
and gentlemen.
Yeah.
Yeah.
Well, why not kill two birds?
You might as
Yeah,
well.
you're right there.
You might as well. I mean, people always try to piggyback things all the time.
Yeah.
Yeah, why not, if you can.
One downtime.
All right. So, interesting case. Do we have any interesting cases that you could think of? One that, even if it's from your training or anything, that pings in your mind sometimes?
So we're doing something really neat. It's kind of a pet project of mine, which is to develop a strong program for functional muscle transfers of the leg. And what is that? These are people that have suffered through cancer or accidents, loss of muscle or nerves in their thigh or their hamstring or in their leg. And what we have to do is then transplant a muscle, usually from another leg or from their back, into where they've missed muscle. So it started with this patient I had several years ago, about 4 years ago, who was a landscaper, and while using a chainsaw, he cut through his thigh.
Oh.
And the orthopedist repaired it, but he split it open. And so afterwards, he was left with a gap about this big, and then he couldn't move his thigh at all.
Yeah.
So
Why didn't they sew them back?
they couldn't
They
then.
couldn't,
Yeah,
they were
they tried once and it
was
ripped, and then
just-
he waited a week, and then it
that's
just
rough.
wasn't coming together. So we did something very unique for him that isn't commonly done. It's something that I had heard about in Asia that they had done only a handful of times. And so what we did is we transplanted a thigh muscle from his opposite leg to span that gap and connect it to the nerves in his leg to basically rebuild his quads. And now he's able to walk and run and work
That's great.
normally, whereas before he was totally crippled. And now, you know, in the years since, we've developed that to do lots of patients. We just had a gentleman who was a police officer who was writing someone a ticket, and they accidentally hit drive on the car, and they
pinned him?
crushed his leg here. Yeah, he lost all the muscles to pick up his foot.
Wow.
So we transplanted a smaller muscle from his thigh into his leg, and after a year of training and physical therapy and work, now because we reconnected and gave him a new muscular compartment, he's able to pick up his leg and go back to work.
Thank
And
God.
we've done that for all sorts of people, you know, from infections in their
wow.
leg or cancer or accidents.
It's amazing.
So that's a very ARSA unique
Yeah.
thing that we're building, and that's the kind of stuff that I love. That's so rewarding to have someone say, I couldn't walk before,
and now I can
here
get
you
back to
walk.
my life.
Yeah.
That's amazing.
Yeah.
So that's really, I didn't know you were doing those things. See, we're learning a lot
There you
today.
go.
So I think that's amazing. I'm thinking now back all my patients that I've seen throughout the years that could have used that. You know, we're
Right.
doing free flaps to save stuff, but they also, okay, so we saved the tissue, we skin grafted, it looks great, fine, but their functions,
Well,
yeah.
that's exactly
Yeah.
how this evolves, you know, and this takes decades of being like, okay, we've now mastered. How do you just do a transplant and transfer the tissue so that you get everything covered? Okay, we've mastered that. Let's take it to the next step. You know, let's add function into it too. And now, not only that, then we'll come back a year later and do liposuction and things, so it actually looks good too.
Yeah, so I love that.
Yeah.
I think that's really, really rewarding.
Yeah, absolutely.
I have an interesting
Yeah.
question actually about how the process of these things come together. I've always been interested in, because I, have a lot of respect for guys like you that are so innovative that can come up with these things. Like you look at something like a gap in muscles and be like, you know what, I think if I take this and move it over here, it might work. So like, how do you go about, one, assessing a need for somebody to actually bringing it to the OR? Like, are there steps that you have to take to try it out on a patient?
Yeah, that's a great question. There's a lot of thinking involved beforehand. we get imaging studies, CAT scans or MRIs, to map out the area fully beforehand. And often what I'll do with that is then send it to a 3D printer. Well, they'll make a model of it. And then using that model, I'm able to then design how I make the cuts and how I will actually mold the tissue to fit that defect and gap. And after we've kind of mapped it all out on the computer, and sometimes a mix of computer and actually drawing or painting it out like an illustration, so we really know what to do, we'll then transfer that template to where we're going to take it from, and then actually do the surgery on top of that.
Wow, that's so
Yeah,
cool.
so it's very planned out. You're not just like,
It's very planned out, yes.
It's like a mix of medicine.
that's how people think. Oh, just this, put it
It's like
there.
engineering, really.
Yes,
It's like
it's
so
like
much
yeah,
engineering.
Yes.
That's a good way of
With a
putting
mix
it.
of art too, because you have to be able to have the
The
artistic
vision
vision of like how things would come together, and like you said before, like not only functionally, but you don't want people to look like Frankenstein walking around, you know?
Yeah, and I think a
Yeah,
lot of it
people
too
don't like that.
is it's like, what muscle are you replacing? What muscle do you take? Which one's going to have enough strength for that area of the body? Like,
And how are you not
there's a lot.
causing functional
right.
issues
Deficit
to
on the donor
donors?
side.
Yeah.
It's all those things
Absolutely.
that really go in.
Yeah.
So that's what you do downstairs.
That's what I'm doing, yeah. We're not,
Like plotting.
it's not just pizza parties.
Yeah. That is really, really cool.
All right, so
Yeah.
Dr. Lakhiani was just married last
true.
month.
Congratulations.
2 months ago?
Thank
how
you.
long ago?
3 months now.
3
Yeah,
months
yeah, almost
already?
3
Oh
months,
my
yeah.
God, it's going by fast.
Yeah.
So how do you work in all these things? Plastic surgeon, plastic reconstructive surgeon, mastermind of muscle
Yeah.
Innovator.
transfers, innovator
Inventor.
of things. Yeah, you're like an Avenger now, pretty much.
Wow. Okay, that's the coolest thing
Yeah.
anyone said.
Yeah.
I don't think I deserve that, but
You do.
do.
You know,
you do.
you,
Here. Yeah.
you
Brain
know,
Avenger.
I'm lucky. It's all a lot of luck. We have a great team. You know, you can't do anything alone. I'd be lying if I said I do any of this alone. I have the best team in the whole world. I have great PAs.
Oh, shout out. You could give her a shout out.
Yep. Nicolette is our rock star.
She's
We'll
awesome.
see you, but so are my nurses. So is my scheduler. And of course, it helps that I have a very understanding wife who, you know, supports me doing all of this, so that, you know, we can take care of these folks, because often we're getting these calls at, you
They
know,
have to
odd
say no
hours.
years
Yeah.
ago. You probably have to say no to these patients, or
Right.
I can't move you any further. You know, I can't do any more. But
Right.
the innovation in our company is insane.
Well, I
Yeah.
think
It really
the-
is.
You know, speaking to that, the lifestyle then can be affected because, you know, you're newly married and your wife, like you said, has to be quite understanding, I'm sure, for your schedule, right? Because
Yeah.
I'm sure you have things planned like everybody, and then sometimes your plans get foiled because there's an emergency or
All
you
the
have to go
time.
in. Yeah.
Yeah.
Constant.
Yeah.
So how do you keep the wife happy in those situations?
You know, when you have to stick to some date nights. You know, you can't get rid of all of them. Someone in med school, actually, he told me that marriage is like you get a deck of cards, and every time you have to say, I got to go to the emergency department, you get rid of a card. But then you have a nice date
gotta
night
put
and
it
you get a little
back. You
card
gotta
back.
put it back. It's
So
like
you just,
Uno.
Give and
you
take.
just it's like Uno, yeah.
Just like
You just
that.
can't get rid of all of them.
Draw four.
Yeah.
Draw four.
Yeah, exactly.
Draw four,
You
Dave.
can stack too these
Yeah.
days. There's new rules to Uno. You can
They
stack.
changed the rules.
Yeah, there's
Oh, I
all
didn't know that.
There's all kinds of new rules.
Oh, I got
Oh
that
my.
deck. It's like the
No mercy.
hardcore no mercy, deck.
Oh
Yeah,
my gosh.
That's where
Wow.
I'm at in my marriage after 15 years. No,
Well,
I'm
it's
kidding.
definitely a
No
it's,
mercy.
it's definitely
My
it's a
husband's
hard
awesome.
balance. Like, you know, Dave's a police officer. Most of you guys know that. So there was many nights where he's like, I'm stuck. I'm working another 12 hours, and you're like, it's Christmas. What do you mean?
Right.
You know. So it's tough. It's definitely a give and take.
Yeah,
I
it's
think that's
understanding.
a lost thing these days in a lot of situations, but understanding is the key to making the world go round. You know, in relationships, between doctor-patients, with everything, it's, you know, it's hard that situations aren't usually perfect.
If only it was, right?
Right.
That'd be amazing.
That'd be great.
Expectation is the cause of all frustrations, or what do they say?
Yeah,
What's the saying?
something like
Expectation
that.
is disappointments or something like that. I don't know. My
Yeah.
therapist will probably chime in.
She's coming next time.
We should have her on. Oh gosh.
We could all use some help from her, I'm sure.
Yeah, reactions.
Yeah,
While watching. Yeah.
Yeah, seriously. Oh my God. All right. Anything else you want to talk about in your practice or anything?
Practice things. I think we've hit, the
Everything.
stuff that we do. I think that it's really important that people understand that when you have issues like chronic pain, a part of you that isn't moving the way it was before, paralysis, things that a lot of people think there's no hope or no treatment for, it's probably incorrect. There probably is hope. There probably is something that we can do, that you can have done. And one thing that I like to do is be very collegial with, the other surgeons, not just locally, but not even only in the country, but in the world. And
Yep.
I've had patients where they have a very unique problem, and I've said to them, well, I might not be able to help with this, but I do know a gentleman in Europe that can. And it's the same. We've had doctors from all over the country refer to me, to us. And because this is such a small field of reconstructive microsurgery, we're all very collegial with each other. So I really encourage patients to reach out, just to ask.
Yeah, because
you'll never
exactly. You'll
lose
say,
anything.
go see this guy, or
Yeah.
here, they do this the best. They're, I think that's great. Because sometimes I feel like medicine is very competitive
Right.
between practices, and our practice is not like that.
Right.
And we will refer out, and people refer in, and I think that's great because we all just have the common denominator of helping the patients, and that's what it's
Right.
about. Because without them, we wouldn't be here.
Yeah.
That's right.
So and some people really lose track of that, I think.
Yeah, I think that it's important we keep reinforcing that we're an alliance. We're the Advanced Reconstructive Surgery Alliance because we're a lot of practices, and it's all just about finding the best outcome for the patient, not about hanging on to something if we don't think we can deliver the best
Yeah.
result.
It's great.
That's
All right.
awesome.
Yeah, ARSA.
Yeah.
ARSAHealth.com.
Well, it was a true honor
Yes.
having this conversation with
Awesome.
such an innovator and mastermind in your field. I
Oh my
thank you
gosh.
for coming.
I think
Really.
it's going to be another couple years. We're going to keep bringing you back and see what you have new.
Yeah.
We're going to keep
Cool.
circling back because you're going to do great things. I know it.
Yeah.
Thank
you already
guys.
are,
Yeah,
so-
well, so are you guys. This is amazing.
Thanks.
It's
You
really
like
a
the
pleasure.
podcast?
Well,
Yeah.
tune in next time for our next episode of
Unfilter It.
With Lindsey and China.
Thank you.